Dr. Nebbeling with Advanced Osteopathic Health is with us again on Morning Blend. Welcome back to the program.
Yeah, thank you for having me.
A pleasure. Talk about the kind of patients that you're seeing at your clinic.
So at our office, we're actually seeing a wide variety of patients, both in terms of age as well as underlying conditions that can be contributing to their joint pain. On one hand, we're seeing the young people, like the high school or college athletes. Maybe they're struggling with a sports injury, trying to finish out the season. But we're also seeing the middle-aged folks, like myself, weekend warriors with torn rotator cuffs, low back pain. We can help with that. And then we're also seeing the aging adults with things like that wear and tear osteoarthritis, who they're trying to get better control of their pain, they're trying to postpone surgery, or maybe they're trying to avoid a joint replacement altogether.
Yeah. Well, what are the types of services you offer your patients?
So at Advanced Osteopathic Health, we practice regenerative medicine. And this is a relatively new and exciting field of medicine that a lot of people at home probably aren't all that familiar with. But essentially what we're talking about is non-surgical joint pain relief by stimulating the body's own natural healing response. And this is all to regrow and repair damaged joints without just putting a Band-Aid on the whole problem. So at our office, we have a couple different ways of going about this. Some of the most common or popular techniques are termed biologics or biologic therapy. And this is things like platelet-rich plasma or PRP, exosomes, prolotherapy. And these are all injection techniques. So a solution can be injected into a damaged joint and stimulate repair like we talked about. But now just within the past year, we've also been using a relatively new and remarkable piece of technology termed shockwave therapy. And this actually allows us to deliver a shockwave through the skin into a damaged joint and stimulate repair without the need for any anesthetic, any needles, or any downtime. And this is one of particular interest for people, say, like me, because believe it or not, Deb, I'm actually not a big fan of doctors or needles myself. So this is something that can be helpful, but ultimately it's always going to depend on the patient's individual case.
Well, how effective are these treatments?
So I think a simple answer to that question would be to tell you that we have found these treatments to be effective in the vast majority of patients that we see in our office when it comes to decreasing pain and increasing mobility. And this really is confirmed by the research. Take, for example, platelet-rich plasma, or PRP. You know, you can do a quick Google search at home and see that there's this ever-growing body of evidence and excitement about this treatment because it's been shown to be safe and effective, and oftentimes more effective than other treatments like steroid injections or other therapies. So, you know, I think this is probably one of the reasons why, you know, it's gaining popularity, and you're hearing about, you know, some of your favorite athletes like Tiger Woods getting PRP to get back in the game. So yeah, we really do pride ourselves on our high success rate, going the extra mile for patients and getting them back to what they love to do.
Fantastic. Always great talking with you. Thank you so much. Find out more information online.